The topic of today's video is chiropractic for pregnant women. So, Dr. Masood, very important question. Why is it important for pregnant women to get chiropractic care?
You know, when we're talking about chiropractic, we're usually talking about spine and a spinal cord. So we like to keep the integrity of a spinal cord and a spine intact. But what happened during pregnancy, women go through major chemical and physiological changes. And one of the big change that they go through is right around this area of sacrum and pelvis. What happened during the pregnancy, your physiology changes in a way that this gets a lot looser, so the birth canal to open up. And the pelvis and sacrum, as you can see here, is a foundation of a spine. I mean, if this is out, you could put everything out all the way to your neck. Usually, when people give birth, the birth canals open. Sometimes it does not close back the way it's supposed to close. In other words, opens up this way and then closes, opens up and closes as the pelvis rotates. So it's a good idea right before pregnancy, get some chiropractic adjustment to make sure this thing is aligned to begin with. So when this thing opens up, it also closes as aligned pelvis and sacrum. And after pregnancy, just in case you misaligned it through the pain, don't forget when you get pregnant, pregnancy is sometimes worse than car accidents. It's a major trauma that the body goes through. And as such, you need to treat it. You need to take care of the body after the pregnancy. And after pregnancy, we need to see if this pelvis is aligned, whether during the pregnancy, because you have relaxant hormone in your body, that all the alignment in your body kept their integrity. Is a very good idea to start chiropractic adjustment from second trimester and go from there.
So is it safe for a pregnant woman to have chiropractic care during the pregnancy?
Absolutely. However, I in my office usually do not adjust pregnant lady with their first trimester for simple reason that lot of pregnancy, they may have complication in the first trimester, and whether you want it or not, if you got chiropractic adjustment, people, they can help with this. Oh wow, that could have been chiropractic. So because the nature of the first trimester, I advise my other chiropractic, not because chiropractic is not safe, but as you know, I adjusted your first trimester. But as a chiropractor, to make it like less complicated between you and your patient, I don't advise to people get it adjusted the first trimester, just to keep it politically correct.
Yeah. Well, I had a very pleasant experience with chiropractic. Both of my first two pregnancies, and as you can see, I am now 4 months pregnant with my third. And before my first pregnancy, I was aware that I had scoliosis, and it was not acute, but it was a severe enough curvature that it was causing problems for me. And I got adjusted for the majority of my first pregnancy, and I actually was able to reverse the scoliosis with chiropractic. So I really did not have a curvature after giving birth to my first child.
Yeah, it's funny when a pregnant woman, because the body's cartilage and tendon are looser than normal so-called people, is a lot easier to adjust a pregnant lady, because the pregnant ladies are getting ready to open up their birth canal. So then naturally the whole system is loose. So it's a lot easier to adjust them. So that was her case. She had a curvature in the spine, but because during pregnancy it was so easy to adjust her, she was aligned perfectly. Certainly by second pregnancy your spine gets aligned very good.
Yes.
And that's the beauty of it. So when you are pregnant, also look at it as an opportunity, because sometimes the segment that you can't adjust and you cannot adjust on a normal person, maybe when you are pregnant is easily adjustable. As such, a pregnant lady, when he gets trauma such as car accident or any trauma, their body is a lot easier, gets misaligned, or they have more consequences as a regular person, because their integrity of body is a lot looser. So that's why it's very important to take care of the pregnant people, not to get
Absolutely.
into accident or traumas that they could misalign their body.
Yes. Well, I definitely saw a difference between uh, the times that I get adjusted and I'm not pregnant, and my adjustments during pregnancy. They were definitely a lot easier. They were more effective. I could see better results definitely when I was getting adjusted during my pregnancies than when I was not pregnant. It's just a lot easier. And you're right, everything is just kind of soft and loose, and it just adjusts really easily. Thank you, Dr. Masood. I really appreciate you taking the time to talk with us today.
Thank you very much. Have a great and healthy day.
See you soon.